Welcome back to our next episode of LCME and Me, helping you prepare for LCME accreditation. Today, we're going to talk about learning environment and mistreatment. So what is the learning environment? What is mistreatment? How do students report it? How do we prevent it? Well, the learning environment is really everywhere that learning happens. So in the classroom, in the clinic, on the hospital floors, in the simulation center, anywhere that students are learning as part of their curriculum is the learning environment. And importantly, that also includes all of the people that they're interacting with in all of those spaces as they're learning. So peers, faculty, staff, etc. As we view the learning environment, it's really important that we think about the professional standards and behaviors that that environment is helping cultivate. And in particular, there are certain influences in the environment that may strengthen those professional standards behaviors and help support their development. And there may be other factors that actually inhibit or interfere with that professional development. And it's incumbent upon all of us to try and strengthen those positive influences and mitigate those negatives. And so that means that we need to be monitoring the learning environment to make sure that that's happening, to make sure that students' professional development is supported appropriately. We have a professionalism evaluation policy that talks about how faculty, residents, and staff are expected to interact with students in a professional and respectful manner. And similarly, students have a responsibility to conduct themselves in a professional manner in all their interactions. And that policy goes on to define the expectation for professionalism that are based around our professionalism program objectives: demonstrate responsibility and accountability, sensitivity and respect, respectful and professional interactions, demonstrating integrity and ethical behavior, a willingness to learn. So as you can see, the learning environment is inextricably linked with professionalism. And that's exemplified in LCME element 3.5 that titled The Learning Environment and Professionalism. In that element, it talks about how we need to have periodic evaluation of the learning environment, strategies to enhance positive, mitigate negative influences like we were talking about, and we need to be able to correct violations when they happen of those professional standards. And so we conduct surveys of students to gauge how they perceive the learning environment. We also assess the learning environment on our course evaluations. And these are ways that we can monitor the learning environment to be able to enhance and mitigate and then deal with violations when they happen. So what about when things do happen, when there are unprofessional behaviors, and what about when those behaviors impact the student directly? When does that qualify as mistreatment? So I have a question for you to consider. Which of the following behaviors by a faculty member would qualify as student mistreatment according to our policy? And you can choose all that you think might apply. So think about which ones of these you think would apply as I read through these. A, making comments about a student's gender identity. B, publicly asking a student a question for which the student doesn't know the answer. C, responding to a student question in a sarcastic tone. D, yelling at a student to make them remember a teaching point. Which of those would actually qualify as mistreatment? Would be A, C, and D. Just asking a student a question that the student doesn't necessarily know the answer to isn't mistreatment, but the others definitely could be. So we have a student mistreatment policy, and it defines mistreatment as when a behavior shows disrespect for the dignity of others and unreasonably interferes with the learning process. And it goes on to describe examples of mistreatment that it can take many forms, such as humiliation, intimidation, speaking in an insulting manner, offensive remarks, etc. So that's how we define mistreatment, but what about reporting mistreatment? So another question to consider: a student in your course or clerkship feels that they were mistreated. How can they report that? So what are the different options? And I'll give you some ones to choose from. Telling you as the course or clerkship director, talking to someone in the Office of Medical Education, submitting a mistreatment incident report, putting the details of that in their course or clerkship evaluation, or contacting the Office of Equal Opportunity. Which of these do you think apply if a student were to report mistreatment? Well, it's all of these. These are all valid options that are available to students to report mistreatment. So starting with the student portal, students can report mistreatment. As you can see here, there's also a related report on any other types of professionalism that they can also make. And importantly, these are anonymous, so students can report these without it being identified. Similarly, on their course evaluation, they're asked a question, have you personally been mistreated in this course? And if they can also describe further in the comments to provide details. Importantly, that's also anonymous when they submit that course evaluation. So I can envision during a site visit, an LCME site visitor might ask a question such as, how could a student report mistreatment in your course without having to fear retaliation? And so think about some examples like these, some mechanisms in which students could report that you could describe. So what about addressing these reports when they do happen? So we monitor all of these reports that come through all these different channels. We monitor those centrally. And one of our curriculum assistant deans will address the report. They do so after grades have been finalized for that course or clerkships to help preserve even the appearance of it affecting the student's performance, because we absolutely don't want to create that appearance. And so we wait till after grades have closed. They do it in conjunction with the course or clerkship director. So you as the course or clerkship director would be involved in that. And we'll talk about how to think through that when that happens. And they also preserve reporter anonymity. Many of these mechanisms, as you saw, are anonymous automatically, but even if the student chooses to disclose themselves, during this process, their anonymity would be preserved. Now, there's a separate process for how reports to the Office of Equal Opportunity are handled, and they have their own processes. So what should you do as a course or clerkship director when you're contacted about mistreatment? So the first thing to do would be think about this mistreatment incident and think through the kind of questions that you want to ask yourself about this incident that was reported. Very often, more information might be required. And so where could you go to get that information? What information might be helpful? Who should talk with the person that's involved if a specific person is named? Is there anybody else that needs to be involved, such as the person's supervisor, or in the case of a resident or fellow, their program director? Are there any other actions that are indicated, such as broader things that might need to be addressed more systematically amongst the group of people? But in addition to addressing the incident itself, you also want to think about how to prevent similar issues from occurring in the future. So based on this report, is this a situation where faculty development might be helpful for the faculty at large in this related to this course, or for a certain segment of the faculty? Would it be helpful to send out reminders about certain situations or appropriate interactions with medical students, or how to support their professional development in a helpful way? Because just as important as it is to deal with the reports when we receive them, it's also important that we're trying to prevent mistreatment. And there's an LCME standard that element that specifically talks about that. So I'll give you a scenario to consider. So consider this scenario in a clinical learning environment. It's a hectic day on a busy clinical team. Students presenting a patient to the team on rounds. It's a disorganized presentation. The senior resident on the team interrupts the presentation and criticizes the student in front of the team, saying, "You need to get it together. You sound clueless, like you don't know what's going on. You're wasting our time." The student leaves that interaction feeling humiliated. So we'll deal with that report when it is, if the student chooses to make that known, we'll address that with the people involved. But let's also think about how we could have prevented this, or what could be done in the future to prevent things like this. So one intervention could be to make sure that faculty and residents are setting clear expectations up front. And so in this case, it might be things like, how should a student prepare before rounds? What should the format of their presentation be? But those kind of clear expectations can make it clear to students, just like it is to faculty and residents, what the expectations are so that everybody's on the same page. And so how do you help the faculty and residents set those expectations clearly? Another intervention that can be helpful is how to have deliver effective feedback. And in this case, focusing on the skills and behaviors in this example, oral presentation, not making it feel personal. Also considering the setting that the feedback is delivered in. Maybe this feedback would be better received one-on-one rather than in a team setting. So how do we help faculty deliver feedback effectively? And then being respectful in communication and reminding people that we always have to be respectful no matter what type of communication, no matter what the setting is. So these are some examples of ways to prevent mistreatment to try and cultivate an appropriate learning environment. So in summary, we have a learning environment, and that's everywhere that learning happens and all the people involved in it. It's our collective responsibility to monitor that and try and enhance it. And then we have mistreatment. It's important with that everybody understands the definitions of what constitutes mistreatment. We do have multiple ways that students can report mistreatment. Many of those are anonymous. And we need to make efforts to educate faculty, residents, and staff in order to prevent mistreatment. So thank you for joining me in this episode of LCME and Me. I look forward to seeing you on other episodes.